says health, is it just physical fitness, social well being, and having a great economic life? No. Let's change our perception towards defining health. Health is a state of physical wellness, social well being, and having a great mental stability. Now, it's so important to talk about mental stability these days. That's why we celebrate World Mental Health Day on October 10th internationally. And now, this year, the World Health Organization has came up with a new theme, and that is mental health in an unequal world. Still, the highlights of discrimination are the same, like caste, creed, lack of human respect, gender discrimination, etc. So don't be afraid of, don't be ashamed of. Speak out, open up. We are here to help, we are here to listen.
Research shows that there is deficiency in quality care that provide to people with mental health problem. It can take 15 years before medical, social and psychological treatment for mental illness that may need them in everyday practice. Stigma and discrimination experienced by people who experience mental health also affects their physical and mental health. Not only affects their physical and mental health but also job opportunities, educational opportunities and also affects their families too. This inequality should be addressed because it is not allowed to continue. We all have a role to play and ensure that people with lived experience of mental health are integrated with all aspects of life. People who experience physical illness may also often experience psychological distress and mental health difficulties. Nowadays, majority of people experience anxiety and depression along with unsatisfied happiness.
Everyone, including me, believes that we are mentally stable. But are we really fit? In order to analyze that, I'm here to give you some set of questions. So, here comes the first question. Are you unable to concentrate without any unrecognized reason? Do you get troubles of regular insomnia? Do you lose your temper easily? Are you unhappy without any cause? Are you afraid of everything without any underlying causes? Are you upset while your daily routine is disturbed? Do you have numerous pains or aches that a physician cannot find any physical cause? Do your children consistently get on your nerves? Do you have wide fluctuations in your mood? Do you believe that you are always right and other person is wrong? These are the questions to evaluate one's mental health status. So, now we can find out the types of mental health illness.
I know that you guys are eagerly waiting to know the types of mental disorders. So, let's start.
Common mental disorders: schizophrenia, affective disorders, anxiety disorders, somatoform, and dissociative disorders. The other forms are schizophrenia, eating disorder, bipolar disorder, autism, attention deficit disorder, addiction, and substance use disorders. Yes, something is missing, and it's depression, affective mood disorder. Basic affective disorders are of two types: unipolar depression and DAD, that is mania or depressiveness. Depression is a mood. Depression is a syndrome. Depression is an illness. Yes, depression is an illness.
Clinical depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act.
Depression can be a leading cause of disability in the world, and since it's a mental illness, it can be a little harder to understand. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. While getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes, there's no triggers at all, it just pops up out of the blue. But when these circumstances change, all these sad feelings just disappear. But clinical depression is different. It's a mental disorder, and it won't go away just because we want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or do anything.
Depression can have a lot of different symptoms: a low mood, loss of energy, loss of interest in things you would normally enjoy, poor concentration, sleeping either too much or too little, changes in appetite, feeling restlessness or excessively guilty, recurrent thoughts of suicide.
Depression should be treated by healthcare professionals. You should not try to handle it alone or treat it using alcohol or illegal drugs. Treatment includes psychotherapy or talk therapy, use of certain medication, and sometimes brain stimulation therapy. If you think you might have depression, try talking to a trusted friend, a family member, or a clinical care provider.
Or if you know anyone struggling with depression, encourage them gently to seek out any of these options.
Let's discuss about signs and symptoms. Before discussion, we should understand these two terms. What does it mean? Simply, the sign means the objective evidence, symptom means the subjective evidence. Here is the first point. The patient feeling sad or down, excessive fear, worries, and extreme level of feeling guilt, and always in a confused state, inability to concentrate, extreme mood changes, inability to cope up with daily needs and stress, withdrawal from his friends and activities. Also, problems arise due to drug abuse and alcohol consumption, sex drive changes, and also the patient feeling low energy, tiredness, and he doesn't get enough sleep during nights. These are the main signs and symptoms occur or feeling in a person who is suffering from mental illness.
Mental health is a way of describing social and emotional well-being. The person needs good mental health to develop in a healthy way, to build strong relationships, to adapt to changes, and deal with life's challenges. It's normal for humans to sometimes have low moods, poor motivation, and trouble sleeping. These things aren't always the signs of mental health problem. But if you notice any of the following signs, and the signs go on for more than a few weeks, it's important to talk with them. The next step is to get professional help. Mental health and well-being is important to individuals, families, schools, workplaces, and communities. There is a role for all of us to play. Here are some ideas to promote their mental health and well-being. Show that you're interested in what's happening in their life. Praise their efforts as well as their good points and achievements. Value their ideas and opinions. Enjoy spending time together. Encourage them to talk about feelings with you. It's important for them to feel they don't have to go through things on their own and that you can work together to find solutions to problems.
And considering the basic humanity, I assure that I'll be a support to the needed. It's okay to feel unstable. It's okay to dissociate. It's okay to hide from the world. It's okay not to be okay. Open up, listen, and speak out. The world will hear you. You are not alone. They are always there for you.
You are not alone. We all need to find ways to stay connected with our community.
There is hope, even when your brain tells you there isn't.